The surge in new coronavirus cases and hospitalizations has pushed the U.S. healthcare system to its very limits. Since Election Day, U.S. officials have reported more than 100,000 new cases every single day. Hospitals in the hardest hit areas are returning to a strategy from the beginning of the pandemic. They're bringing in help from other facilities to treat new patients. I want to bring in now Lydia Mobley. She's a nurse helping to meet the needs of an intensive care unit in Michigan. Lydia, first of all, thank you for what you're doing. And then I want to say, this isn't your usual hospital. You're one of these many medical professionals who have offered to help in these areas of highest need. Tell us why you signed up for this assignment.
I actually am in the Navy Reserves currently. I joined last year, and after doing a year of active duty, when I came home, obviously COVID is hitting really, really hard, and there's such a huge need for nurses. And I was a travel nurse before the Navy, and you can't say no when the need is this high right now.
Well, thank you for your service on 2 counts.
Thank you for your
Tell us
support.
more about what you are seeing, what you're seeing. How many patients are you responsible for at any given time?
In the ICU, the ideal ratio is either 1-to-1 or 1-to-2, depending on the patient's acuity. Unfortunately, because right now there's a lot more patients and a lot fewer nurses, we're not getting those ideal ratios. Sometimes it could be 1-to-3. In other states, I have friends who are reporting 1-to-4 in their ICUs, which again is not ideal at all, but unfortunately it's the reality of the situation.
And what are patients telling you about the experience that they're having, what they're going through?
Unfortunately, once they're on the ventilator, they're unable to speak because, again, a ventilator is a tube that goes in your mouth and down your throat and assists you in breathing because you're unable to do so. And they're also sedated. But before patients need to be intubated, they are struggling to breathe, which is very difficult to watch. And a common thing that we hear is that they didn't think coronavirus was real. They didn't think it was serious. That they just didn't believe it until now it's kind of too late. Or we hear that from families on the phone when we have to call and update them. And it's just very sad that it's not being taken seriously until it's too late.
You've been dealing with this pandemic really since the beginning. I'm wondering if you can tell us how you've seen the situation change since the early days of the pandemic.
To be clear, I was still serving on active duty when the pandemic started. But just in the last month at the hospital, you can see a change, just an increase in the number of cases. ICUs are expanding at the hospital I'm at. Currently, that's the case, as I know it is across the country. Resources are getting fewer. There's fewer nurses, as I've already mentioned. A lot of nurses had to quit their jobs to stay at home and homeschool children, or else nurses that were older, in the older generation who were, didn't really have a reason to retire yet. Now COVID certainly gave them a reason. So, and then obviously with just the dramatic increase of patients, those 2 things have kind of created the perfect storm.
Lydia, given that, I'm wondering, do you have the supplies you need? Do you have adequate PPE?
I'm truly lucky that this hospital does have adequate PPE. I get a new N95 every shift, or more often if the N95 I'm wearing became soiled, because that's not the case at many other hospitals across the country. I have a lot of friends in healthcare, obviously, and they're reporting different situations, but I feel truly blessed. I mean, it's sad to say that, but blessed that I do have enough PPE to protect myself, and obviously my coworkers are protected as well. But supplies are running out in a lot of places, if they haven't already, again, as I mentioned, at other facilities. But our hospitals are running out of COVID body bags. This COVID body bag kit comes with specific tags to mark that the patient died from COVID or was COVID positive at the time of death. And those are running out. The American
Lydia,
Red Cross.
I think that's striking that you've run out of COVID body bags. Oh, what do you do when you run out of COVID body bags?
We used a regular body bag because, again, it's essentially the same thing. It's just the tags, and we have to just get tags to, again, protect the workers in the morgue and the chain of those who care for who take care of the postmortem care of patients for their protection, so they know who was COVID positive. Another thing is treatments are running out. One of the treatments we're using right now is convalescent plasma, which is plasma taken from donors who have recovered from COVID. And unfortunately, there's not a whole lot of donors. There's always a blood shortage in this country. So I encourage everyone to sign up for blood donation, but also, especially if you've recovered from COVID, convalescent plasma is really needed right now. It's one of a few treatments that is shown to be effective. And again, it's not a cure by any means, but it's one of the treatments that we're using. But unfortunately, there's already a shortage of that as well.
I want to ask you also about respirators and also to follow up on your point about blood donation and convalescent plasma. Are there other things that those of us who are healthy can do to help?
Oh, absolutely. And the number one thing is the easiest thing, and that is just to wear a mask. Just please, please, please wear a mask, because if not for you, and you should for yourself, but also for those you care about, because it's really sad for me to call families, because again, they're not allowed to visit when their family member is COVID positive, because of the dangers and the risks. It's very sad to me to call and hear the regret in their voice, that maybe they could have done more. Maybe, not to say they should, but I think everybody should be doing more to protect their elderly family members or just themselves, because it's, again, a lot of people. It's hard to watch someone struggling to breathe and see the regret that they have, the regret for not just wearing a mask, or maybe not going to a party, or not going to that wedding, or maybe not going to that church service, because in the end, people are dying because they didn't realize the seriousness of the situation. And it's hard to watch.
Oh, it's honestly, it's hard to listen to. I can't imagine what you see on a daily basis. Have you had COVID? Are you scared as you go to work?
I'm absolutely scared, not so much for myself, but just for my family. I try to social distance from my family as much as possible, which is hard. But I stay in touch, call my grandma every day. And, but I'm not scared so much for myself, but for those around me. But again, I take the proper precautions. Again, at work, we get specially fitted for our N95. Some hospitals use respirators, but N95s can be disposable, and you get that proper seal around your face that you need. And then we wear the face masks. The image that you're showing with the it's called a papper, the hood that goes over your face, and that's special for people who cannot fit into it. For whatever reason, everybody is different, so they may not fit an N95. So there's different forms of PPE, which is good because you can use different methods, so hopefully the supply chain lasts a little bit longer. We obviously use face shields like I'm seeing in your images here, and then there's obviously the gown and gloves that you're also seeing.
I should note that is not your hospital. That's illustrative of what is going on inside of hospitals. And Lydia, you mentioned how difficult it is to see the fear in people's eyes and in your patients' eyes, to witness them struggling for breath. How do you take? And I'm still thinking about what you said about running out of COVID body bags. I'm wondering how you take care of yourself during this. Even as you are helping others, how have you been able to keep grounded, to keep going?
It's a struggle every day, and I feel sorry for my coworkers more who have been dealing with this since the beginning of the pandemic. Because again, I was serving active duty in the military, and as hard as the military is, this is just. I didn't imagine to come out and come home to this, that's for sure. But nobody predicted this. But I feel sorry for my coworkers who have just been struggling because they're just doing the best they can for themselves and obviously for the patients. But the advice I'm given a lot is, just survive. I think we all have our breakdowns. Again, I had a COVID death of, well, I mean, there's COVID deaths every night, but one of my particular patients, I held her hand because again, there's no family allowed in the rooms, and I'm sorry, but I did break down. It's hard and it's a frustrating situation. But you don't want anybody to die alone. But there's still more patients that need care. But in their moment of passing, when all other measures are exhausted and the family has chosen to make them comfort care, you try to make them comfortable in their last moments, because nobody deserves to die alone. But unfortunately, families aren't able to be at the bedside with them. And that's another really tough thing, but it's happening across the country every hour. I'm not sure on the exact statistics, but I know in my hospital and I'm hearing from friends across the country that people are dying, and it's just very sad. And I hope more people will understand that something as simple as a mask, or not going to a party, or whatever small steps can make a big difference.
Lydia Mobley, we as a nation owe a debt of gratitude to you and all of the healthcare providers. Thank you for sharing your experiences with us.
Thank you so much for having me and helping me to spread this message, because if it reaches just a few people to implore them to please, please, please wear a mask, that would help.
Absolutely.